Okay, we're going to continue with the last video for this examination of the peripheral vasculature. So what we're focusing on right now is the jugular vein pulse or pressure. Now if you look here, we have the patient in a supine position as here as noted. Now you could raise his head a little bit more if you'd like, if you can't really see the jugular vein that well. In this case, we're going to go ahead and focus here on the way that the patient is lying, and look here at his jugular vein there. You can see it palpate there. I'm not sure if that's very well lit, but you would use tangential lighting just to visualize it a little bit better. But I'll go ahead and point it out to y'all. It's right here where you can see it pulsate. Maybe here would be a better view. Can you see that there? Okay. So when you start to visualize that jugular vein pressure, now jugular vein pressure could tell you one of many things. For example, if you have heart failure and you have a backup of blood in your heart, you will see jugular vein distension here, which will be amplified by placing some pressure here on the right upper quadrant on the liver. So you could use both hands to put pressure here, and you can feel the ribs, and then when you get here below the rib, go ahead and press up, and then you want to take a look here how it affects the vein. And you should see you should see the pressure increase for a couple seconds and then go ahead and decrease. In other patients, however, that do have heart failure, you will see that it is constant, and that pressure is not relieved by relieving the pressure on the liver. This is what you call a hepatojugular reflux. Okay. So another way that you can go ahead and measure jugular venous pressure, actually, and give it a number, is you can use a ruler such as this one. Okay, and when you have the patient lying down this way, you will go ahead and place the ruler mid-axillary along the nipple line, just like that, and then you'd go ahead and measure to see where that where you see that distension of that vein. So if you look here, now this ruler is a little bit different. You'll see that the 0 centimeter mark is right in the middle of it, and then it goes downward to 15 on either side. So in this case, you could use another ruler that goes horizontally. In this case, I'll go ahead and estimate, pretend that we're using a horizontal ruler to see exactly where we see that vein distension. And I'm going to say it's about this mark right here where my pinky's at, the 7 centimeter. So if you count up from the 15 mark, 1, 2, 3, 4, 5, 6, 7, 8, that's about an 8 level to where we see that vein distend in his jugular area. Normally that will indicate what the jugular vein pressure is, so in this case we could say it's about a 7. Normally you wanted anything below 9 is considered normal. Another way to be able to reassess that or reevaluate that number is, again, placing the ruler right there. And what you would do is you would go ahead and ask the patient to go ahead and I want you to pay attention here to the veins on his hands. Go ahead and have them sideways like you did right now, because I think it's better visualized. Now you see here that the veins are very nicely visualized, and as I press on them, you can tell that the blood comes back really nicely on each one of them after compression. So we'll go ahead and ask him to keep his arm like that, because I think we can take a look at the veins a little bit better. And then while we're going to ask him to go ahead and lift his arm up, right, and paying attention as to where, when he's rising his arm, where they begin to collapse, which should be about the same number as we had gotten before, which is about a 7. So we'll go ahead and ask him to do that. So go ahead and raise your arm slowly, please. And then you'll see there that they collapsed right there. So we'll go ahead and look over this way. Now remember that we were at about the 7 mark, is that correct? So if we go along this way, if we flatten out his arm here, like that, we will note that maybe we're a little bit above that, okay? So we can attempt to assess it by coming a little lower. Maybe we went a little too fast there. And we're still flat there, so we'll go ahead and cross. And then now we're about the same, at about the 7 that we were at last time. So that is a way to be able to measure that jugular venous pressure using a ruler. Remember, mid-axillary at the nipple line is where you want to place that. And also you want to assess where you see the vein distension here, and using another ruler going across to be able to know where on the horizontal, on the vertical axis you're at, and then also using the moving of the arms to be able to confirm that for you. Now, I want to point out one important thing about veins. Now, we very often have patients that may have vein obstructions in the lower portion, just as well as you see in the arteries. Now, in a case that you feel that this patient may have some vein obstruction, let's say in the lower extremities, there's something that you call a Hohmann sign to be able to determine if this is so or not. When you do this, you want to go ahead and ask the patient to go ahead and dorsiflex his foot and then bend his knee upward. If this causes pain for him, then you know that the patient has some type of obstruction or thrombus in the leg that's causing that, because he's having that calf pain. Now also, you want to kind of take a look at the extremities. Most of the time, if you have an obstruction in one of the veins or dilatation, you will have swelling. Okay, you will have swelling in the extremity because all of that fluid in the vasculature is beginning to leak out because that blood isn't circulating as quickly as it's supposed to. And as we all well know, the vasculature is permeable. So very important for one to know that as well. Now also, most of the time these patients do complain of tenderness. There is redness, like I said before, swelling and pain to the site in cases of occlusion, such as a thrombotic occlusion. This is what we most often refer to it as a deep venous thrombosis. Also, whenever you see that a patient has swelling in the legs, you want to also rate it. And I know that we were talking about rating when we were talking about pulses in the arteries. We want to know from 0 to 4 how much of a bound we have. In this case, it's a little bit different. We're testing for edema, but we also rate it on a 1 to 4. 1 being that the pitting is not all that bad. You press on it and the pitting goes away fairly quickly. And 4 plus being when you note that you press on that area and it is deeply pitted after you release it, and that it takes about 2 to 5 minutes for it to come back to its normal size or normal way that it was before. Now, in patients that may have varicose veins, because I know that we see many patients that come in with varicose veins. Now, if you feel that it might be because the venous system is incompetent, now one way to be able to test for this is that you can ask the patient to go ahead and stand up. And what you do in this case is you ask the patient to go ahead and do heel raises 10 times. So you go ahead and raise, do calf raises 10 times. And if you see those varicosities go away after this time, then you can possibly say that the venous system is okay. But if it doesn't, then you know that that's a positive sign for the varicose veins and a possible incompetent venous system. Now, one last thing that I would like to touch on, and it's actually going back to the arteries. I know that we were talking about assessing the patient for the arteries and them having claudication or not perfusing very well because the patient may have arterial stenosis or any other problem that may be occluding the flow. One way, since I have the patient like this right now and I can describe it, one way to be able to test for arterial perfusion, adequate perfusion, is you can go ahead and lift the leg of the patient upward, and this creates the flow of blood to go back towards the heart and away from the extremity. And then you go from that position and ask the patient to go ahead and sit down with his legs downward. And when you do this, you assess the legs to see if you know, from going a little, if they regain the circulation. And you look at the skin of the patient. When you place the legs up, you should see it kind of become a little more blanched. They look more pallid. And when you sit them back down, you should see the regaining of the same color of the legs, as well as perfusion to the feet. If you don't, and it takes a while to get that color back, then you know that you have you possibly have some type of arterial problem. So that concludes the examination of the peripheral vasculature. Thank you for watching, and we hope to see you all back with us for the next video. Thanks.